Hi, everyone, and welcome to today's webinar hosted by the American Academy of Pediatrics. Today, we'll be talking about ways to treat colds and flu at home, and we're so glad you've joined us. We have lots of great information to share with you. A few pieces of housekeeping, though, before we begin. The audio for today's event will come through your computer speakers, so be sure they're turned on and the volume is turned up. And we will have time at the end of our webinar for a question and answer session. To ask a question, please use the chat feature. Just click on the speech bubble or the person icon on your screen, and you can send those questions in at any time. Now it is my pleasure to introduce our host, Dr. Jennifer Hsu. Dr. Hsu is a practicing pediatrician, author, and mom. She's the chief medical editor for unhealthychildrenorg, and she's a co-author of 2 parenting books, Heading Home with Your Newborn and Food Fight. She's a frequent guest on national and local television, radio, and web-based programs. She has served as the Living Well health expert for CNN, has contributed medical information to Baby Center and WebMD, and serves on the Parents Magazine Advisory Board. Welcome, Dr. Hsu.
Thank you so much for having me, Mary Claire. And welcome everybody for joining us today. Thank you for taking the time to listen in on our 10 tips for treating colds and flu at home. Ironically, I've had a cold for almost 3 weeks now and I'm just getting over it. So you may hear a little bit of a cough or a sniffle from me here or there, so I apologize in advance. So as you know, coughs and colds can make kids and us as their parents miserable. The symptoms can be uncomfortable, they can last a long time, as witnessed by my cold currently, and they can often make sleep somewhat of a challenge. We as parents often are looking for a fast way to get our little ones back to their energetic and happy selves. And although I really wish we had a quick solution, unfortunately there is no magical cure for the common cold. Your child will probably have many, many colds in her life. We also call them upper respiratory infections, and they are more common than any other childhood illness. In fact, in the first 2 years alone, most kids will have at least 8 to 10 colds. And for some kids, that's even 8 to 10 colds a year. This is especially true if there are older children in the house, since colds can pass so easily from one child to another. And unfortunately, this is the kind of sharing that we don't really like our kids to do. You'll find that most colds happen in the fall and winter time when people are spending time in closer quarters. Some viruses, such as influenza virus, some of them thrive better in cooler weather. And so sometimes during winter cold and flu season, it can feel like your child is sick nonstop if they have back-to-back colds lasting anywhere from 1 to 4 weeks at a time. The good news is that there are a few things that you can do to help ease your child's symptoms during a cold, and we're going to talk about a few of them today. Most importantly, though, if you're worried about your child's symptoms, be sure to contact your pediatrician for more details on how to make your child feel better. That's what we're here for. So first, we're going to talk about medicine. If you take a quick walk up and down the cough and cold aisle in your local store, it can be extremely confusing because there are so many products that are designed to treat upper respiratory virus infections. There are a lot of brands and types available, but it's no wonder that many parents can find looking for remedies for their kids to be stressful or confusing. The ones that you'll find in the store are often called over-the-counter or OTC medicines. And what that means is that you can buy them without a doctor's prescription at your local drugstore or grocery store or big places like Target and Walmart. Over-the-counter medicines are available to treat things like pain, fever, allergies, rashes, stuffy noses, or stomach issues like constipation or diarrhea. And the way you can tell is by looking for those symptoms listed on the products. They may say fever or pain or stuffy nose or runny nose. And many of them are combination medications that treat several symptoms with one product. So you ask, which medicines should you give to make that cold go away? Well, the honest answer is that probably none of them, because medicines cannot make the cold go away any faster, unfortunately. And in fact, the AAP recommends against using any oral cough and cold medicines for kids 4 and under. And for kids from 4 to 6, only if advised by your pediatrician. And the reason for that is that medicines don't work well, and even though you can buy them without a prescription, there can be many possible side effects. So the bottom line is it's not worth it. And also, since colds are caused by viruses, prescription antibiotics will not help. So please don't ask your pediatrician for an antibiotic if your child just needs to kind of bide some time to let those symptoms go. A good home remedy is one that is safe, inexpensive, and just as beneficial as OTC medicines. Luckily, there are a number of home remedies that can help ease the symptoms of a cold, and many can be found in nearly every home. One such product is a humidifier. So these are found in many homes, especially with young children. They can definitely help kids with a stuffy nose, and a cool mist humidifier is what I usually recommend. These are designed to thin out the liquid that can cause the stuffy nose so that it's easier for your child to breathe. The extra moisture they provide can also soothe a sore throat and possibly calm a dry cough. Since humidifiers make the area closest to them most moist, put it close to your child but safely out of reach. And be sure to follow any instructions and clean it or dry it every day to prevent bacteria and mold from growing. We do recommend avoiding hot water vaporizers, also called warm mist humidifiers, because any type of contact with a child or spilling could be harmful. On the other hand, you can provide steam from a shower, and what you would do is let steam fill the bathroom with the door closed and have your child sit maybe on the floor or on top of the toilet lid or near the shower and just breathe in some of that steamy air for a few minutes. As a safety reminder, definitely avoid direct contact with that hot water. Another good way to relieve a stuffy nose is with saltwater saline drops or sprays in the nose. Just 1 or 2 drops or sprays in each nostril can help loosen mucus and help children breathe more easily. You can buy commercially made saline nose drops and sprays in a pharmacy without a prescription, or you can make your own saline solution by just adding a half teaspoon of table salt to 1 cup of warm tap water. For infants, rest your baby in your lap so that her head is tilted slightly back. And then squirt a drop or 2 of saline into 1 nostril. For some kids, that may be all you need to do. She may sniff it in or sneeze it out, and that will clear the passages in and of itself. For other kids, it may be helpful to use a suction bulb. And what you would do with that is after inserting saline into 1 nostril, squeeze the suction bulb before putting it into her nose. Gently place the tip of the suction bulb into the nostril, and then as you slowly stop squeezing and let air flow into the bulb, the mucus should flow out of her nose and into the bulb as well. And then you want to do that same procedure on the other side. And much as you sometimes may blow your nose holding 1 nostril down while blowing the other side, it can be helpful to hold the opposite nostril down for your child so you can get a better suction when you're using the bulb. And then don't forget to clean the bulb afterwards using hot soapy water or sterilizing it. You may need to repeat this process a few times every day, especially before bed or feeding, to help relieve stuffiness and congestion. Since babies do breathe through their noses while eating, doing this before feeding can help them breastfeed or bottle feed easier and longer. During a cold, it's important to encourage your child to drink plenty of fluids. When there's enough water in the body, it can help thin the mucus in the nose and throat, making breathing easier. Plus, feverish kids can lose fluids and may become dehydrated more easily, so it's really important to keep those liquids coming. Keep in mind that breastfeeding is still recommended for infants with colds, and if it's difficult for your baby to feed directly at the breast, you can try expressing your breast milk into a cup or a bottle. For older kids, your pediatrician may recommend watered down fruit juice or sports drinks or flat soda, and warm teas or soup can also help soothe symptoms and raise your child's spirits. Coughs are a frequent symptom of upper respiratory virus infections, but as we talked about earlier, cough medicines are not recommended, especially for young children. But one thing that can help and is a good cough remedy for children over age 1 is a teaspoon or so of honey, which coats and soothes the throat. You can mix honey with a little bit of lemon juice or put it into a simple herbal tea. In fact, honey has actually been studied in comparison to cough suppressant syrups, and it does as well without the side effects. Sick kids who got a spoonful of honey before bed had better sleep and less coughing. And the good news is that it doesn't take a whole lot of honey to give your child relief. For kids age 1 to 5 years, a half a teaspoon may do the trick. For 6 to 11, use 1 teaspoon of honey. And for kids 12 or older, you can try 2 teaspoons of honey. Keep in mind that honey should not be given to babies under a year of age because it can cause infant botulism. And that's true even if the honey is cooked or pasteurized or heated or frozen, any of the above. Just avoid honey under age 1. And if your child is under a year and has a cough or other cold symptoms, definitely check in with your pediatrician to see if your child needs to be seen in the office. Medicated rubs have been used as a cough and cold treatment for a long time. And maybe you remember them from when you were a child, and I remember them from as recently as last week because of my cold. They are very common and found in many households and have been around for years. Most medicated rubs that you'll find will have 3 active ingredients, and these include menthol, camphor, and eucalyptus oil, which studies have shown can help relieve cough. Rubbing it onto your child's chest and neck can be soothing and calming, especially at bedtime. For children ages 2 years and older, rub a thick layer on the chest and throat. On contact, the body's warmth releases the medication into the air for up to 8 hours. And when breathed in, the vapors can help soothe the cough so your child can sleep. For children under age 2, non-medicated chest rubs may be available and can be soothing as well. Remember that medicated rubs are a type of over-the-counter medicine. So just like any other medication, be sure to read the label before using it and put the container away and out of reach after each use. Also remember that medicated rubs should only be used on top of the skin, on the chest and neck, and only as directed. Sometimes the best remedy is actually rest. Rest and sleep are how the body recharges its immune system. Colds can interrupt a child's sleep, which can make them even more tired. So if possible, reduce your child's schedule for a few days by letting her stay home from school or child care, or just skip a day or 2 of after-school activities, and take it easy at home until their energy bounces back. Even when kids don't have colds, it's important to make sure they're getting enough sleep. The American Academy of Sleep Medicine and the AAP provide some helpful guidelines regarding just how much sleep children need at different stages of their development. Infants from 4 to 12 months of age should be getting about 12 to 16 hours of sleep, counting naps. Toddlers from 1 to 2 years of age should get 11 to 14 hours of sleep, including naps. Preschoolers from 3 to 5 need 10 to 13 hours, including naps, while kids from 6 to 12 need about 9 to 12 hours each night. Teenagers should really get about 8 to 10 hours of sleep every night, even though many of us know that our teens aren't getting that amount. And before you say that there's no way your kid's going to get this much sleep, I do challenge you to try to make sleep a priority for your family, because it definitely can be done if you put your mind to it and rearrange your schedule possibly. And I'll just share with you that up until the time my child was 10 years old, he was sleeping 12 hours a night from 7 p.m. to 7 a.m. He would go to school, he would go to baseball practice, eat dinner, go to sleep. And it turned out that he was extremely well rested, well behaved, could concentrate well in school the next day, and had a very good immune system. And I like to attribute some of that to the fact that he got a lot of sleep. So if you can, try to prioritize your child getting the recommended amount of sleep that you see in this chart. It can be very easy to worry when your child is sick, and sometimes parents will tell me that they don't know whether they should call us or not. So let me say that it's always fine to call your pediatrician if you're worried about your child, because as I mentioned earlier, that's what we're here for. It's good to keep in mind that older kids with colds usually don't need to see a doctor unless they look sick or their symptoms worsen over time. But for babies and young children, it's a little bit different. So always call your pediatrician if your baby is younger than 3 months and has any fever at all. And the number that we use for fever is 100.4 taken anywhere in the body. So let's say you take it under the arm or rectally or using a forehead thermometer or in the ear. Just tell us the number that you got taken when you take the temperature and tell us how you took it. It's not necessary to add or subtract or do anything to the numbers. Just tell us, I got 100.4 when I took my baby's temperature rectally, and then we'll use that information as you tell us more about your child's symptoms. So definitely for any child younger than 3 months with a fever or any temperature at all, no fever but they're acting sick or you have any concerns, call us. If a child is 3 to 6 months of age, then definitely call us if there's a fever of about 101 or higher. And for children older than 6 months of age, maybe a temperature more like 103 or higher would be worth calling about. But again, any temperature, if you have concerns, is worth calling. You should also alert your pediatrician if you know any of the following conditions. Number one, if your baby's very dehydrated, and signs of this would include the fact that she hasn't had a wet diaper in 6 hours, or if your child hasn't used the restroom in more than 6 hours, or if your child has a dry mouth or has few or no tears when she cries. Definitely you'll want to call us if cold symptoms don't even start to improve after 5 days. And sometimes this could be an indication that something else is going on, such as a sinus infection or ear infection or even pneumonia. If your child seems very fussy or sleepy, especially if she's missing meals, that can be a good reason to call. Or if your child is breathing very rapidly or has labored breathing. Also call us if your child refuses to drink, because this could be a sign that she could be having trouble breathing. And it could be also a sign that she's going to get dehydrated soon. And finally, do give us a call if your child has severe ear pain or any other pain, such as sinus headache, sore throat, neck pain, or muscle aches. Our last topic is about prevention. And while it's impossible to completely prevent your kids from catching colds, there are a few things you can do to reduce their risk. One of these things is hand washing. And if you have small kids, you know how challenging it can be to get them to wash their hands often and thoroughly. But it's super important and can really cut down on the spread of colds and other illnesses. So you can make it a game and sing a song while washing. Doing the happy birthday song twice while washing hands is a good amount of time. You can let your child pick out which soap she's going to use. Basically anything that you can do to make your kids want to wash early and often. For kids where soap and water aren't available, hand sanitizers can be a good substitute. And as a last resort, you can always use baby wipes, which most parents will have handy at any time. It's also important to cover coughs and sneezes. And even young kids in childcare and school can learn to cover their mouths and noses with a sleeve or an arm or a tissue when they cough or sneeze. So some of my patients like to tell their kids to pretend to be Batman, like you're pulling your cape over your mouth and nose when you're coughing. Or if your kids know how to dab, cough while you're dabbing and cough into that bent elbow. For babies under 3 months of age, the best prevention is to keep them away from anyone with a cold. A virus that can cause a mild illness in an older child or an adult can cause a much more serious infection in an infant. And babies under age 1 or 2 months who have a fever may need to be evaluated in the emergency room, and that can include things like blood tests, urine tests, and even a spinal tap if there's a concern that baby may have a severe infection. So do try to prevent your baby from getting that fever in the first place by avoiding anybody who's sick with a cough or a sneeze or fever. And while there is no immunization yet for the common cold, there is one for influenza or the flu. And as a reminder, the AAP recommends that all eligible children 6 months or older get a flu shot every year. Children younger than 6 months are too young to get a flu vaccine, but you can protect them by making sure that the rest of the family gets their flu shot. Flu season is still here, so if your family hasn't gotten their flu shots yet, today is a good day to get that done. And in fact, National Influenza Vaccination Week is this week, December 2nd through 8th, 2018, as proclaimed by the CDC. And they do have a National Influenza Vaccination Week every week just prior to the holidays, and this has been going on since 2005. So remember to get that flu vaccine. So finally, let's review what we've talked about today. We've talked about the fact that cold medicines are not the best treatment, but some simple home remedies can help provide relief for most cough and cold symptoms in children. And some of these include humidifiers, steam, saline nose drops or sprays, extra fluids, honey, medicated rubs, and lots of rest. We also went over some of the signs that tell you it's time to call the pediatrician. And finally, we talked about the best ways to prevent cough and cold viruses from spreading in the first place. I hope you found these tips to be helpful.
Thank you, Dr. Hsu, for all that great information. We do have some time still to answer some questions. If you have not already done so, please use the chat window and send us your questions. If you are given the option, please chat with all panelists. That way Dr. Hsu can see everything, and she will try to respond to the questions in the order that they arrived. However, please know that she may not be able to get to all of them. And so I'm going to give Dr. Hsu a moment to look through all these great questions that we have. And I will take this opportunity actually to invite you to register on unhealthychildrenorg. If you do so, you get our free newsletters every month. You actually get a personalized homepage that provides you some information that is specific to the ages of your children, and you will be alerted when we have some special offers.
So the first question we have is about the flu shot. And one person asked if babies need 2 doses of the flu shot, and that's a great question. So for a child under the age of 8 years getting flu vaccine for the first time, 2 doses in that first season are recommended, and they should be spaced by at least 1 month or 4 weeks apart. That's 28 days. So talk to your pediatrician if this is your first year of your child getting the flu vaccine, whether they're 6 months old or up to 8 years old. Another question I got was whether people should stay away from milk or hot chocolate. And in doing some reading in the past, I did find that milk can possibly cause congestion in a small percentage of people who have colds. So maybe not even 20%. As an old wives' tale, you might have heard that milk is not good during colds because it can make you congested. Well, it turns out that hydration is probably the most important thing. So if your child wants to drink milk, they're most likely going to be fine with milk or hot chocolate or any type of fluid like that, just because most people do fine and do not develop extra congestion from things like that. One question I got was whether using a medicated rub on the bottom of the feet and covered with socks at bedtime can help reduce coughs. And that is a common question that I get. What I usually say is that any type of medicine has been tested in certain ways, and the label states the safest and most effective way to use that product. So in general, I would say to follow the directions of the product on the label, and definitely just ask your pediatrician if you have any further questions. Another question I got are, what signs should you look for in your baby's chest to indicate that there's trouble breathing? So as a blanket statement, I usually say, let us know if your baby is having fast or labored breathing. And what I mean by labored can mean things like the chest is heaving up and down. It looks like your child's panting. They're huffing and puffing. It looks like they just ran a marathon. You may see the muscles in between the ribs pulling in and out, or the muscles right in the neck, or the nose may be flaring. So watch your child normally when she's breathing and get a good sense of what she looks like when she's calm. When she has a cold, look for anything that seems different from that or seems like she's having trouble. I'm going through some of the other questions. There's a good question about when you can start using hand sanitizer with children. And one of the things that I've seen is to use hand sanitizer in children over the age of 2. And I think that's one of those situations where maybe it's a labeling situation, not for use in children. But in general, you want to be able to use things like hand sanitizer or even soap in kids where they're not going to stick their hands directly in their mouths afterwards. So in children over the recommended age on the product label, also make sure that that sanitizer dries completely before you let them go on their way. And that's how the product tends to work best. If your child is 1 year old and has a cough but is otherwise okay, how long should you let it go on without calling the doctor? So children over age 1, we kind of mentioned it's common to have colds anywhere from 1 to 4 weeks at a time. And usually what we see is after about 7 to 10 days or so, those symptoms do slowly but surely get better. So if you're not seeing any improvement at all by the 7 to 10 day mark, even without a fever, I think that's a good time to give the doctor a call, because there could be a chance that your child has an ear infection or a sinus infection, even though she may not be old enough to tell you. One question came in, it's how do I know if my baby under 6 months has sore ears? And I'm going to kind of expand that to say, how do I know if my baby under 6 months has an ear infection? And that's a great question because, as you know, kids can't tell us necessarily if they have pain, but they may be crying or sometimes tugging on the ears. That's a very nonspecific sign. A lot of kids tug on their ears or touch their ears once they find them. Some kids do it as a self-soothing behavior. Some kids do tug on their ears and cry or point, but that's not always the case. So signs of an under 6 month old baby with an ear infection might be a cold that's lasting longer than a week, a cold with a fever, or especially if the baby lies down to sleep and starts crying and can't fall asleep. And the reason for that is if you imagine that your ears are full of fluid or pus, when you lie down, gravity makes that pressure even worse, and it pushes out against the eardrums, making it hard for the baby to sleep, especially if she's trying to concentrate and relax, and the only thing that she can feel is her ears. Sometimes that can be a sign of severe teething as well. So that's a great question. The best way to clear up stuffy noses for older kids so they can sleep, pretty much those are the same thing, using a humidifier, fluids, a saline spray or drops, medicated chest rubs. Same remedies can help kids who are older as well. Another question I got was, what might you use on your child's skin, especially under the nose, if it's very dry and raw from running? And that's a great question. Anytime you can use some kind of barrier like petroleum jelly under the nose, or some people even use a diaper cream, it can kind of help the skin from getting chafed by the constant rubbing and wetness from a runny nose. So you may want to try something like petroleum jelly or anything recommended by your pediatrician. Question about fever suppositories. Acetaminophen can come in the form of a rectal suppository for kids who are either vomiting or refuse to take oral medicine. Sometimes these are found behind the counter. So even though it's available without a prescription, it's behind the counter non-prescription medicine that you have to talk to the pharmacist to get. And medicines that are intended to treat fever or pain are based on your child's weight much more so than age. So talk to your pediatrician before using pain reliever, fever reducers, including those in suppository form. And then most of the other ones are kind of related to the rest of the questions that we had. So if anybody has any further questions, I would definitely recommend that you visit unhealthychildrenorg. One last thing that I will address is that somebody asked about daycare and school as well, and this pertains also to work. And should you send kids to school if they have a cold virus, such as a runny nose or a cough? Aren't they passing viruses to other little ones? So yes, they are definitely passing on viruses, although people are most contagious probably starting about a day before getting any symptoms at all to the first few days. So during fevers or the first few days of a cold virus, people are the most contagious. And as we talked about earlier, since kids can have 8 to 10 colds even every year, with each cold lasting 1 to 4 weeks at a time, it can be very impractical to keep children out all the time. So I would definitely keep kids out who have a fever, and usually the recommendation is to stay away from school, childcare, or work for at least 24 hours until they're fever-free. But if they're low energy or if they are having a hard time with a lot of cough or runny nose and just need extra TLC, let them stay at home, because they won't get the kind of attention that they need if they are having to share, care from a teacher or a child care provider. So try to use your judgment and keep your child home when they're the sickest, especially early on in their illness.
Thank you so much, Dr. Hsu. This was really great information. I wanted to just remind everyone to please follow us on social media for more great children's health information. We're on Facebook and Twitter and Pinterest. And starting in the new year, we'll be on Instagram. Our information is available in English and in Spanish. So we look forward to talking with you and seeing you there. And thank you very much for joining us today, and we hope you enjoyed our webinar today. We will have more, so stay tuned and tune into healthychildren.org as often as you can to learn about future webinars. And we wanted to give a special thanks to our sponsor of today's webinar, Vicks Vapor Rub. Thank you so much, everyone. Have a great day.